My attention has once again been drawn to cross-border truck drivers. In the last few weeks, we have witnessed a large number of truck drivers at border points testing positive. Let me make it clear that all drivers take a COVID-19 test at least 48 hours before embarking on their journey and acquire a COVID-19 free certificate. We have, however, noted that a majority of the truck drivers are commencing their journey to the borders without this valid document, expecting to be tested at the border points. This has resulted to unnecessary congestion and delays that have been witnessed at our border points. This is purely indiscipline, which is unacceptable and will not be tolerated. I'm urging our law enforcement officers to take appropriate action against each such driver flaunting these measures. Na wajua tunaambia mambo mengi tukiwa hapa, habari hawa madereva. Kule port KPA, wale ambao wanaingia huko wakiwa na magari, kwa sababu tumetoa amri ya kwamba hakuna driver ambaye anaweza patiwa mzigo na gari akiwa yeye hana COVID-19 certificate. Lakini wale wanafikiri ni wajeuri sana, wanapatiana gari zao, wanaingia port na driver moja ambaye ana certificate. Anaingia ndani ya port, anatoa mzigo, akitoa mzigo kufika hapo nje, anapatia driver mwingine ambaye hajafanywa test. Huyo sasa ndio anatoka kutoka hapo, anaenda mpaka Busia. Na mimi nashangaa sana kwa sababu najiuliza, kutoka Mombasa jameni, na mimi nikitembea mimi mwenyewe nasimamishwa ma roadblock mengi. Huyu mtu ni kusema amepitia njia ingine ambayo haina roadblock, ama ni kusema alipitaje roadblock na anaenda mpaka Busia. Mimi sitaki kusema ati kuna kitu ama mimi sioni, lakini wewe mwenyewe jiulize. Hata ukiwa wewe sio mwelevu sana, unafikiri alipita namna gani kutoka Mombasa mpaka akafika Busia? Alifikaje huko? Pertaining to our COVID-19 situation today, 124 people have tested positive from 2,640 samples in the last 24 hours. Therefore, the total number of positive cases in Kenya now stands at 2,340, while the total number of samples tested so far is 87,698. The positive cases include 119 Kenyans, 2 Somalis, 2 Tanzanians, and 1 Eritrean national. These figures do not include the number of foreigners we have tested at the border and turned them back to their countries. Mombasa had the highest figures today, standing at 40, while Nairobi at 38, and now Busia at 26. You can see what I'm talking about. All these 26 people you are seeing here from Busia are essentially truck drivers who are being tested at that spot. Now, which then bears and brings a big problem for the Busia government, because it means you have to start quarantining, isolating people who are not necessarily from the Busia county. Kajiado, the same thing, with 6 of them again, and so on and so forth. Now, today, Elgeyo Marakwet becomes the latest county to report a COVID-19 case, bringing now the total number of counties that have been affected to 36 out of the 47. In Mombasa, the 40 cases that were there, out of the 40 cases, 14 of them are from Mvita. Again, the same thing. We have 14 from Kisauni, and 11 from Changamwe. The same trend again in the same areas. In Nairobi, we have 38 cases from Kibera, 25 from Kamukunji, and 25, and the cases from Kibera, a lot of them are in the quarantine facilities. 25 from Kamukunji as well. I would also like to add that in terms of gender, again, 100 are male and 24 are female. We still have to come down and find out why over 70% of the infections are still in male and are still the male gender. In Garissa, the 2 cases that we got came from Dadaab, and while in Muranga, we have 1 case which is in Kiharu. Now when you start hearing of these rural areas, then you know that we really do have community infections. We are also happy today that we have discharged 39 patients from various health facilities, bringing our total number of recoveries to 592. We want to pray that we get more of those, and we want to completely support and thank our healthcare workers for the work that they continue to do to see that as many of our people as possible recover. Unfortunately, we have also today lost 4 patients to the disease, bringing the number of fatalities to 78. Our sincere condolences go to the family.